The number of COVID-19 cases in the United States is about to skyrocket, and I wanted to make this video with the explicit message that this upcoming increase in detected cases does not necessarily mean that the spread of the virus itself is accelerating. Even though that could well be the case, I want to make you aware of the cognitive bias that most people would very likely be susceptible to when they see the number of reported cases skyrocket. You should avoid falling into the same trap that most others will fall into because we're seeing a lot of panic behavior already throughout the world. The need of the hour is a sober, clear, and most importantly, a calm understanding of the situation on the ground. Hey guys, my name is Atif Shahnawaz. I'm an internal medicine doctor, and I make videos explaining medical concepts in a clear, easy to understand way for layman people. Please hit that subscribe button if you'd like to see more content from this channel. Now, the main reason that we're about to see COVID-19 cases skyrocket to the thousands of Americans in the next week or two is because we are finally deploying the ability to test more people. Unfortunately, the American response to news of COVID-19 hitting our shores has left a lot to be desired. We missed several opportunities to become aggressive about this problem and will soon be exposed to the consequences of those initial missteps. For example, when South Korea first found COVID-19 within its borders, within just 1 week, 66,000 people were tested. And very quickly, the country ramped up the ability to test more than 10,000 people every single day. Now, in contrast, even though the first COVID-19 case in the United States was detected a few weeks ago, to date, the total number of cases tested in the US is only a few thousand. According to some detailed investigative reporting done by The Atlantic, as of 3 days ago, March 6, 2020, they could only find evidence that 1,900 tests were done. So in fact, this is also a symptom of the problem that the journalists from The Atlantic arrived at this number by doing a lot of work. They had to call public health departments in all 50 states, they had to go to several different public health websites, and they spoke with dozens of state officials in order to arrive at the total number of tests conducted to date. This in itself is a huge problem because we should by now have a centralized reporting mechanism where data throughout the country can easily be collated and examined. Now, for better or worse, the steep decline in stock markets around the world and the quarantining of the entire country of Italy is finally leading to a more proactive and robust response to COVID-19 here in the States. So we'll soon go from having tested just a few thousand people to tens of thousands in the weeks to come, and a more accurate picture of the extent of COVID-19 will begin to emerge. Now, you'll have to keep in mind that the easiest way to keep the confirmed cases of COVID-19 down, not just in the US, but in any country, is to just not test for the disease. So why do you think, for example, that North Korea doesn't have any reported cases? It's not because they have a great healthcare system. Here in the US, we have really been behind the 8 ball when it comes to ramping up testing. So as testing capacity finally begins to ramp up, I fully expect the number of confirmed cases to go up significantly. As the reported cases skyrocket, you'll need to keep in mind that this doesn't necessarily mean that COVID-19 is suddenly spreading much faster than it was before all the tests rolled out. It just means that the true picture of the disease is finally being revealed. I can't tell you if the spread of COVID-19 is accelerating in the US or not. No one can tell you. Unfortunately, it will be weeks before that question can be answered with any confidence. The first thing that needs to happen is that testing capability has to become easily available throughout the United States so that anytime a doctor wants to test a patient for the virus, that test is easily available and has a rapid turnaround time, just like we do have for the regular flu. I think that we are weeks away, if not months away, from something like that being possible. But it's only once we are there, and once we are truly capturing a consistent amount of COVID-19 cases, that we can truly start to map out an accurate trajectory of the disease and say with any level of confidence if the spread is slowing down or speeding up. Until testing capability saturates the healthcare system, we are literally in the dark about the question of COVID-19 acceleration in the United States. Now, I guess I should also make a comment or two about why I think COVID-19 is more widespread than we've suspected up to now, and why testing will reveal that. The reason is that once it entered, COVID-19 has spread quickly in other countries. I don't know why the US would be exempt from this experience. Furthermore, COVID-19 made known landfall in Washington state a few weeks ago. And since then, we have not enacted the kind of aggressive containment measures that countries like Japan, China, and South Korea deployed relatively quickly into their outbreaks. I suspect that the disease has been spreading here in the US for the last several weeks, and we're about to find that out. So again, I want to prepare you for the next few weeks because the number of cases will go up dramatically, and it can be really disconcerting to shine a light on this infection and discover that it was a lot more widespread than we had been led to believe. Now, I've heard some people on the news say that we only have a few hundred reported cases, so there's really no need to be concerned. But those people miss out on the fact that testing capability has been very minimal up to now, and hopefully that will change soon, but as it does, it can lead to some uncomfortable truths that we can best prepare for simply by expecting it. As the number of cases keep going up, just remind yourself that we are only now just discovering cases that were already positive. And I keep stressing this point because we're seeing way too much irrational fear amongst people in other countries already. People are going to the supermarkets, they're stocking up on supplies, which I think is completely unnecessary. Things are not that bad, and I doubt we will ever get to a situation where that will be necessary. Now, I'm going to keep following the COVID-19 story, and I'll be making regular updates on this channel. I try my best to explain things simply without losing accuracy, so if you'd like to hear more sober, clear explanations on COVID-19, please click on that subscribe button and the bell notification icon as well, so you can get regular updates. Share this video with others as well if you think they'll find it useful. Ask me any questions you want in the comment section, and I'll respond to you down there. As always, thank you so much for watching, and I will see you all in the next video.